So, Dr. Jonas, why is addressing burnout such an important topic for physicians?
Well, Drew, we were already having trouble with burnout before the the bomb was dropped on the world with the COVID pandemic. Many of the frontline people, intensivists, emergency room physicians, primary care physicians, and others were approaching 40 to 50% criteria for burnout. So we already had a challenge in the system in dealing with burnout. And I think now with the rapid change that's going on, with sort of the implosion of the economy, with the decline in both revenues and the capability of doing even basic clinical care, for now, that has just exacerbated the change on top of this. So it is extremely important that we up our game in burnout prevention and management. And so, your questions are very appropriate for these areas. I mean, the reasons for burnout have been very well, for avoiding burnout have been very well delineated. The National Academy of Medicine did a major study on it, published last year. American Academy of Family Physicians made it their theme over the last year, physician well-being. The reasons for those are well known. With burnout, we have reduced empathy and the ability to actually provide care, and that part of healthcare. We have less responsiveness to the needs of patients. We pick up less on what's going on, and therefore we're less accurate in our diagnostic and treatment decisions and capabilities. Trust gets eroded. There's an increased chance of error and mistakes, and therefore harm in these areas. And now if you pile on top of that the economic stresses that are occurring both for those in practice as well as for our patients, we've got a problem.